So once again, we have multiple disciplines brought together by Dr. Garg today for us to explore the ability to bring in this integrative thinking as a possibility. Dr. Samantha is an interim leader of the South Asian Health Institute and manager population health and health equity at Fraser Health Authority. She has over 20 years of experience working across the continuum of health in diverse settings in Canada and internationally. Samantha is a physiotherapist and holds a Masters of Public Health with a specialty into global health, and previously worked for the Public Health Agency of Canada prior to joining Fraser Health. So, Samantha will be talking, bringing various other dimensions from the South Asian health perspective, and also how you can actually percolate, bringing evidence based approaches to empower the South Asian community. Over to Samantha for understanding this concept better.
Thank you very much for the introduction, and thank you, Dr. Garg, again for inviting me. So I'm hoping that I will be able to share my screen and it's going to be okay here. So just tell me if you cannot see the start of the slide. Can everyone see this, please? Just let me know.
We can see.
Can I unmute? Can everybody hear me okay?
We can hear you fine.
Okay,
yeah.
perfect. Thank you. Thank you. Just a second again. Okay. So I'm honored on behalf of my team to be sharing with you some of the work that we've been doing. And that's actually a very nice segue to what Mark just presented in terms of the pentagram model, really kind of showing like how we are starting to do that integrated approach. And so this is the work of my team and myself prior to the COVID-19 pandemic around chronic disease prevention. To give you some context of the Fraser Health region and the South Asian community that lives in the Fraser Health region. In the Fraser Health region, over 75% of the South Asian community lives here. I mean, Fraser Health is quite diverse, but we have over 300,000 people who are South Asian or self-identified as South Asian in the community. Amongst the South Asian community, they have higher rates of chronic disease compared to the general population. It's 2 to 3 times more likely or for a South Asian person to, to have a chronic disease compared to someone who is not South Asian. Some of the barriers that we've experienced in the past in terms of engaging with the community are a number of them, including a lack of awareness and knowledge of health issues that are relevant to them, a lack of accessible and suitable services appropriate for the community, and also literacy and language barriers. SAHI was created in 2013 with a vision to be a global leader in advancing evidence-informed practice for South Asian health, really to improve the health and health outcomes of the South Asian community in our region, really focusing on culture, innovation, evidence, and the key is really to empower them to make the healthier choices, both as a community and at the individual level. Our mandate. We're a small team, we're not that big, and so we are not offering like services per se to the community, but we're really leveraging our partnerships and our network to really help support and build on the existing work and enhance and expand it. So that we are able to have a better understanding of the key health issues affecting the community in our region, and also supporting the development and implementation of evidence-informed and culturally relevant health promotion activities, including for injury prevention as well, again, at the program level and the community level. And really a key to our work is partnering with organizations, both locally and provincially, to advance these practices, as also to leverage and hopefully be able to spread these benefits and learnings more globally.
Samantha, I apologize for interrupting you, but when you shared, you actually shared your desktop. So did you want to try to share your presentation again?
I'm not sure how. Okay.
I mean, your talk is wonderful. I'm enjoying it all, but I think if you have slides, you can see the slides as well.
I'm not sure how, because I'm seeing my screen here, and then I have the other screen, so I'm just sharing, and then I don't know how to share further. So I apologize.
No, you first just select share screen and then whichever is your PowerPoint, then you select that.
Okay, learning here. Thank you very much.
Well, this conference is all about learning, so we learn in multiple dimensions.
Appreciate everybody's patience here and humoring me throughout the whole time so far. But thank you, Minnie.
Yeah,
so again, just to show you the lovely slides that I was talking about prior to, and I'll continue after. So the context here, our vision, our mandate, and then now onto the Sehat program. So Sehat program is our community-based program, part of SAHI, and it's really our innovation to look at how do we do health promotion at the community level, and it was created in response to the higher incidence of chronic disease in the South Asian community in Fraser Health. And really, we look at how do we engage, how do we empower, how do we educate in a way that's most useful and resonates with the community and most effective. So really to look at how to make healthy choices, but also looking at those environments. How do we create them in a way that supports our community to make those easy choices? And key levers that we also are using and leveraging are health literacy. We can't assume that what we talk about, how we talk about things, people will understand in terms of how it relates to them and their health and how they can make the changes appropriately. Community engagement, as has been talked about, and also in terms of our partnership development. And Mark had mentioned something about, or there's a question around to Mark about for the pandemic, and Mark was saying about the strengths and the positives of the network and partnerships that we had really helped to secure us to build further as we were responding to the pandemic and continue to do so. So there's a number of different things as part of the Sehat program that we've done. So Sehat Cooks is really our project with the kitchens at the different places of worship, at the gurdwaras, at the Hindu temples, to work with the kitchens because they produce a large amount of meals for the congregation. And so we really worked with them to reduce the sugar, salt, and fat content of the food that they prepared. We worked with them on other recipes. We've also worked on portion size in terms of what's offered to the community when they come to the Langar kitchens, and also for how the food is displayed, where things are. So having the healthier options more upfront, rather than the different sweets and carbohydrate types of food closer to. So kind of promoting that, encouraging that healthy choices sooner. And we do take the approach of meeting the community where they're at and really understanding literacy levels and also diversity of the community. So we provide the provide the materials and support in different languages, in a simple language that's visual. And we have been focusing on healthy eating. And so here you see some of the posters that we've created to help people understand a bit more about what's in their food and how can they make those healthy choices. And the next slide here, some of the common sweets enjoyed by the South Asian community. You can see here how many teaspoons of sugar in one piece or one serving of each of these. So one jalebi has 6 teaspoons of sugar. Another area of work that we did was what we call Sehat Works. And this is a project working with workplaces and businesses, South Asian businesses who have employees that they want to help support in terms of eating healthier and reducing the sugar intake. What we have found in our 2016 report on the health of the South Asian community in our region was that over 50% of the South Asian community were eating fast food, high in sugar, high in fat content. So this was a kind of way to spearhead this. And some of the things that we've done with the workplaces is to create roadmaps. So depending on where they're situated, we would look at what are the local places they could get food, what are the food options there, and looking at, okay, this is how you could pair this, how you can make a decision in terms of we want to choose this one, giving them information about how much fat, sugar, etc., and also how you could also make it healthier. For example, instead of a juice, have water instead. And so we actually were able to work with a construction company, a car dealership, as part of this project, and we've seen some initial success in terms of the employees who started to have participate in this project actually started to demonstrate more healthier behaviors, including also getting more active, which was great. stay at schools. So another setting that we focus on is with the local South Asian community schools, and really working with the parents, the students, and the staff, the teachers, to co-design the activities that are relevant to them, meaningful to them, and effective. So really trying to leverage like the champions within each of those groupings, but also to get a better understanding of where they're coming from. So we've had different focus groups with each of these groups to learn more. And it's interesting, you know, the parents are saying, okay, well, they don't have many ideas, they need recipes, don't have much time. And that their children are not interested in the meals that they prepare for them for school lunches. The teachers are saying, okay, the kids are bringing unhealthy lunches, but also maybe the kids may have a lack of knowledge of what's healthy in terms of options for food. And then the kids are saying, well, we don't like some of our lunches, you know, so it's kind of like, you know, trying to find that balance of like how we can make it work for the entire community at the school. So that is my presentation, and thank you very much. And I hope I've reached time. I'm sorry I couldn't see the timer.
No, thank you. You are perfectly in time. And first of all, let me congratulate you. Amazing job, amazing work being done. And as I said, each speaker is making us learn so many things. Particularly, it's a new thought, you know, like bringing projects in the name of Sehat. And under each one, you have multiple objectives. And one of the objective is how do you actually bring in a change in eating habits of individuals. Really something nice which each one of us can adopt in our countries and in our organizations. Certainly something nice to see. Over to Minnie for questions.
Thank you for that great presentation, Samantha. And it's like music to my ears to hear you give an update on SAHI. SAHI was one of the recommendations from our first CINI conference in 2010, which was focused on cardiovascular disease. So what a great update, and lots of great work that's happening there. We do have a question. You know, you actually mentioned, and Mark talked about the importance of the relationships in responding to pandemics, and SAHI was in place for that. What was one of the challenges that SAHI faced in responding to COVID?
That's a big question. I would say it's the, as you all have experienced it, also we all have experienced it, is the pandemic. It's new. Everything is new. We knew nothing about the virus, nothing about how to respond. We're learning as we're going. So I think the biggest challenge was the uncertainty. Knowing and trying to find that relevant information to support the community immediately as much as possible, because we did get a lot of calls, but we still didn't know a lot yet. So I think the challenge was to work with the uncertainty and support the community in the best way possible with the evidence we had available to us at that moment. I'd say that's the biggest challenge, and it keeps changing. That's the challenge too. Sorry, that is the bigger challenge. It keeps changing on us. So we don't always have the know-how of what's going to happen, what's next. And so we need to constantly adapt and change and shift. And I'm very proud of my team that they've been able to pivot so quickly each time.
Thank you. And I just want to note that we did have a comment, Samantha, that your presentation was great even before you had the slides put up. So
thank you.
That your message was coming across good and clear there. Another question that we have is, could Sehat and I guess SAHI in general program support personalized menus?
I'm assuming the question is around personalized menus for the individual, like a community member. We haven't done that, but that I think it's dependent on the person, him or herself, depending on the health status. And so I would say we could do one for, say, general advice for the general community, but not for a specific individual, because we don't know the history and we don't offer that service. But we could definitely make sure that that person is connected to a healthcare provider to provide that appropriate personalized menu.
Perfect. Thank you.
Minnie, if I could just interject on that, because this is a very good question and Mark will recognize one of the recommendation for CINI will be and has been our dream how to move into this fifth discipline. Fifth discipline is precision nutrition at the community level. So we are really hoping, and you'll hear from later on from speakers from Queensland, how do we bring academic rigor to that fifth discipline of role of intervention, personal intervention, and how does it work? So Sahi and Sehat is just the start of starting the conversation of interventions, and next step is this personal precision, but requires a lot more academic evaluation and rigor. So thank you very much for that question, but that is on our agenda, and we will follow that up. Thank you.